Hello and happy Sunday. We are back again for our weekly sit-down Sunday Q&A with great questions from you. This week we are talking about choosing a hospital to deliver at.
Yep, and then also what we do for our own child's pediatric care and what we do when she's sick. Just in case you've never met us before, I'm Kurt, I'm a board-certified pediatrician.
I'm Sarah, I'm a board-certified OBGYN,
and we are the Doctors Bjorkman.
So, first question this week comes from Madeline Davis, and she said, how early do we need to decide what hospital we want to deliver at? I was asked in my 12-week appointment and I felt so taken off guard because I hadn't even thought about it yet. So, we do have an episode all about kind of choosing your OB provider that you can check out, but it sounds like you have chosen your OB provider. So, let me start here. Sometimes, people actually choose the hospital they want to deliver at because of location or proximity to where they live or XYZ thing. Hey, I really want to deliver at this hospital. And then they find out what groups deliver there and kind of find out what your options are within that one hospital. If you have chosen your OB provider and you feel like that they are a wonderful fit and you feel comfortable with them and you're at your 12-week visit and they say, hey, what hospital do you want to deliver at? The next follow-up question for them is, hey, what are my options? You know, does your group deliver at multiple hospitals, which some do, and then kind of ask, hey, what are the plus minuses of these different hospitals? I think often groups really kind of deliver at one hospital, so your group, may only deliver one place, but if they're asking you this, then maybe they deliver multiple places. So things I think about when you think about which hospital you would want to choose are questions I would want to ask is, hey, is there 24-hour anesthesia at this hospital? Or the other, if you're comparing two. In-house 24-hour anesthesia, if you're thinking you may want an epidural during labor, is something that would be important to me because I don't really want them to have to call the anesthesiologist from home who's going to take an hour to get there. I'll be ready for the drugs. So one thing to think about. Another thing to think about is what kind of supportive services do they have there? Do they have a midwife team that they work with that delivers at the hospital? Do they allow doulas at this hospital? Does the hospital have a doula system where you can find volunteer doulas and different things like that? What do they have in terms of, do they have tubs, birthing tubs? How many rooms are their tub rooms? And again, these are things that may or may not be important to you, but these are just things some patients think about. In terms
I think other really important things that you may be actually said, hey, this is where we need you to deliver, either because of high-risk maternal factors or high-risk baby factors.
Like what's their NICU situation and their high-risk service
So depending on if there's any fetal diagnosis of a congenital anomaly that's going to need subspecialized pediatric care, that might be a reason to have you deliver at a hospital that has all of those subspecialty pediatric care needs that your baby might need. Or if you have a high-risk pregnancy, of course, too, and you need maternal fetal medicine to be there for that. That may kind of necessitate you have to deliver at a certain hospital that has those services.
Yeah. So to recap, things you want to think about and talk to your OB about if you have multiple options are what's available for pain services and are they in-house or not, like available 24/7? What is available in terms of supportive care? Midwives, doulas, is there a birth center attached, different things like that. Tub rooms, other kind of, things that you may be interested in terms of your birth plan. And then do you have any health conditions that are going to necessitate you deliver somewhere versus your baby needing a higher level NICU? Some NICUs will not deliver patients you can't deliver at that hospital if you're delivering before 35 weeks or different cutoffs. So kind of what's the NICU situation are all good things to think about when you are planning what hospital to deliver at.
And now our second question of the week. This comes from Molly Redden, and she says, please talk about Cecilia being sick and what y'all do. do y'all take her to a different pediatrician, or is Kurt her pediatrician? So I really enjoy this question. Because she's been sick so much recently.
Constantly, yes.
And
Yay,
also,
preschool.
I am really happy to not be her primary care provider. I
Right.
think,
And generally in medicine, it is recommended that you don't take care of family members just because it's hard to be unbiased
Yep.
in caring for your family members. And
either, and like, unfortunately, the bias is usually a well bias in that, like, oh, they're fine, like, they're gonna get through this, and which is something why, like, kind of knowing myself and that I just want to be dad. When Sarah was in labor, I just wanted to be husband and dad. Of course, like, you've got some knowledge that like helps me look for things and feel comfortable weathering some things out. But we have a primary care provider that we take her to for her normal well checks. We actually have seen a nurse practitioner for most of her well check visits today, but she also has a pediatrician that we see sometimes as well, and we've enjoyed both of those experiences.
very much.
A couple things that are nice in terms of like
The little sicko.
being a pediatrician is like knowing that, hey, when she's sick, knowing like, hey, we want to make sure she's getting all the fluid she needs and keep a close eye. As long as she's making wet diapers, we're happy. We expect she's not going to eat as well when she's sick. Kind of knowing the doses of Tylenol or ibuprofen for fevers when she's sick off the top of my head is nice too. For you at home, follow the recommendations on the box. If your child is less than 2 years of age, ask your pediatrician for weight-specific dosing. I think the other thing is like diaper rashes, and like there's been a time or two where we've needed kind of a special diaper cream for a rash, and it's been like, oh, this is fine to use an over-the-counter cotrimazole, or this one's actually where a mild steroid cream might be okay. But again, those are things that you want to make sure to talk to your pediatrician about. And we've been fortunate to have pretty easy communication using things like MyChart even with our providers to date. So,
So when she gets sick, which again, you know, she started going to a little preschool this year, and she truly has been, it's like every week a new virus, and
there's so much snot.
There
It's just
is,
everywhere.
and I think that if you are not expecting it, you're like, my kid's been sick for a month, when in fact, it's a new, like you'll watch her get a little better and then they go to school again and then they're sick again. I think, what are things that would make us call the pediatrician?
Yeah, that's a good question. So I think the big things there are your goals for any illness are easy breathing and hydration. So if ever, like, and it is okay, and you expect that when they have a fever or some congestion, they're gonna breathe a little bit faster. It's the body's normal natural process. But if they're breathing 60 to 70 breaths a minute for an hour, that would be a thing to say like, hey, like, man, this is not getting better, or her fever's come down with Tylenol or ibuprofen and she's not looking well. Or if she looks like she's just tired, wiped out with that. If she's got really noisy breathing, looks like she's like using lots of extra muscles, whether as you see the skin pulling in between the ribs or under the ribs, or the nose flaring, things like that. Those are also times where, hey, this is not easy breathing. We need to talk to our pediatrician right away. From a hydration standpoint, so I mentioned following wet diapers for her. So you know that your child usually has X number of wet diapers in a day. So be like, hey, Cease hasn't had a wet diaper now for 6-8 hours. This is abnormal for her, and some of that is expected. But if they start going kind of more than 8 to 10 hours between wet diapers, that's a sign that they're really kind of getting quite a ways behind in their fluids, so that they aren't making urine also. So that's a good reminder to say, hey, let's make sure she's drinking, because hydration is the most important part of getting through these illnesses usually. But if you're getting that far where it's 10 plus hours between a wet diaper, call your pediatrician to check in and say, hey, here's what I'm seeing, because dehydration can quickly like get worse too, in terms of when you're dehydrated, you feel crummy, and that makes you less likely to want to drink more too. And so depending on the age of your kiddo, breast milk for those kiddos under 1 year of age is always great if they'll drink that. Otherwise, things like Pedialyte, something that has some electrolytes that they can get back in, is okay for most age groups. I say not to give just straight water for infants in the first 6 months of age, also, just as kind of lots of water can throw off the electrolytes there too. But
what about like ear infections? What are we thinking about with ear infections or pulling on their ears? Like, when would we take her for worried about that type
Yeah.
thing.
So we actually got a call about that. Like, oh, Cece felt a little warm. She's pulling on her ear. That's honestly something you can watch a little bit. Like ear infections are really common. Kind of comes with a fever, sometimes ear pulling, or just like crankiness, which like, of course, actually, as it turns out, most ear infections are actually viral and will resolve without antibiotics. However, if you're having high fevers and there's fevers for kind of more than a day and they're pulling on their ear, have a low threshold to go see their pediatrician. They can take a look at those ears and look and see, even if there's fluid and bulging, again, as I said, it's still most likely viral, but somewhere between 30 to 50% of those can be from a bacterial cause that can get better with antibiotics. And then you get to deal with the loose poopy stools from the antibiotics, but there's things your pediatrician can do to help you with those side effects of antibiotics too.
Totally. And I think the other thing there was also you can call your pediatrician. Your doctors don't want you worrying alone at home. And so something that you're super worried about, other parents are worried about, these viruses are going around, you can call, tell their nurse triage line or whatever what's going on, and they can say, hey, we're not worried about it, we can watch this, or hey, you know what, why don't you bring them in? We just want to make sure everything's okay. And that is part of our job and part of helping parents through this and why you have a pediatrician. So that's always a resource for you too.
We had so many great questions. We try to get to them as we can. Of course, we can't answer them all, but thank you so much. Please make sure you subscribe for our weekly Wednesday content, and then meet us back here next Sunday for another Sit Down Sunday Q&A.
Have a great week.
Bye, guys. We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.